In today's video, we are going to discuss cancer, which is one of the biggest killers in the world, and its possible cures and treatments.
What is cancer? Cancer is a group of diseases that involve abnormal cell growth with the potential to spread or invade other parts of the body. It's important to distinguish that this is different from benign tumors, which are localized and do not spread to other parts of the body. There are over 200 different types of cancer, and while some are easily curable, others can be often fatal. This disease is very fascinating and mysterious. So now Aaron is going to tell us more about cancer cells.
Cancer cells have one major difference when compared to normal body cells, and that is that they do not stop growing and dividing when there are enough of them. This means that the cancer cells just keep doubling, forming a lump known as a tumour, which continues growing. The exception to this is blood cancers, known as leukemia, which do not form tumours. Other unique features of cancer cells are that they do not repair themselves and they also never die. The reason for this is that in cancer cells, molecules that ordinarily decide whether a cell should repair itself are defective. An example of this is a protein called p53, which checks if the cell should repair its genes or if the cell should die. Cancer cells have a defective version of the p53 protein, so do not repair themselves or die. Apart from these functional differences, cancer cells are also structurally different, and so look different to normal body cells. Some key differences are the following. They are a different size and can be either much larger or smaller than normal body cells. They often have an abnormal shape externally. Their nucleus also has an abnormal shape different to a normal body cell.
One key question that should be considered is what causes cancer? The answer to that question features many different factors, and I'm going to discuss some of them. Statistically, for the majority of cancers, around 90 to 95% are caused by genetic mutations from environmental factors, and only 5 to 10% are caused by inherited factors. The use of tobacco is a major factor as it contains more than 50 known carcinogens. Alcohol is another factor as 10% of cancers in males and 3% of cancer in females is caused by alcohol exposure. Diet, physical inactivity, and obesity are another major factor as they are related to 30 to 35% cancer deaths. Other factors are radiation, such as UV from the sun. One interesting fact is that taller people have an increased risk of cancer due to the fact that they have more cells than people who are shorter. Since height is mainly determined by genetics, people who are taller have an inheritable increased risk of cancer. As you can see, a lot of factors are preventable. So we encourage our viewers to avoid activities like smoking and physical inactivity.
Now we are going to discuss some of the main types of cancers, such as carcinomas, leukemias, lymphomas, and sarcomas. Carcinomas are cancers that begin in the skin or the tissue that covers the surface of internal organs and glands. This type normally forms solid tumours and is the most common type of cancer. Common examples of carcinomas include the following: prostate cancer, breast cancer, lung cancer, and colorectal cancer. Leukemia is a blood cancer caused by when blood cells change and undergo rapid growth. Common examples of leukemia are acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, and finally chronic myeloid leukemia. Lymphomas are a type of cancer that originate from the lymphatic system. The lymphatic system is a complex network of many vessels and glands which help fight off infection. The two types of lymphoma are the Hodgkin lymphoma and the non-Hodgkin lymphoma. The final type of cancer are sarcomas. Sarcomas begin in tissues which support and connect the body. Therefore, it refers to cancers which develop in areas such as fat muscles, tendons, joints, cartilage, and bone.
Diagnosing cancer is a very crucial process, as the earlier it is diagnosed, the higher the chance that the patient will survive. Because of this, I'll explain different testing methods that are utilized. Lab tests are an accurate method of diagnosis. This is because a high or low level of certain substances in your body can be an identifier of cancer. So, lab tests are done to test samples of your blood, urine, or other bodily fluids. These lab tests can also involve testing blood and tissue samples for high level of tumor markers for cancer cells. Many types of imaging tests are also conducted, such as CT scans, MRI scans, nuclear scan, bone scan, PET scan, and even ultrasound and X-rays. In most cases, doctors need to do a biopsy to diagnose cancer. A biopsy is a procedure where a doctor does surgery to remove a sample of tissue. Then, a pathologist uses this to create a report diagnosing the cancer, and this report helps decide the treatment options. There are three main ways to do a biopsy. The first method is to simply use a needle to withdraw tissue or some fluid. This method is primarily used for spinal taps and bone marrow aspirations. The second method is known as an endoscopy. Here, the doctor uses a thin, lighted tube called an endoscope to examine an area in the body for abnormal tissue to be removed. The endoscope enters through naturally bodily orifices, such as the mouth or anus. More specific examples of endoscopy are colonoscopy of the colon and rectum, or bronchoscopy of the trachea, bronchi, and lungs. Final method is surgery, where abnormal tissue is removed during an operation. This can either be an incisional biopsy or an excisional biopsy. An incisional biopsy is where the surgeon only removes part of the abnormal area. However, in an excisional biopsy, the surgeon removes the entire area of abnormal cells, and often some of the healthy tissue is removed as well.
Treatment for cancer is arguably even more important than diagnosis, and there are a variety of methods currently being officially utilised by hospitals around the world, which I will now discuss. Chemotherapy is a treatment of cancer with chemotherapeutic agents known as cytotoxic anti-neoplastic drugs. These drugs act by killing cells that divide rapidly, which is a key property for cancer cells. Research has proven that delivering combined cytotoxic drugs is more effective than administering one single drug. So, multiple are used in a process called combination therapy. There is also a form of chemotherapy known as targeted therapy, which targets specific molecular differences between cancer cells and normal cells. Radiation therapy is the treatment through the use of ionizing radiation to cure cancer or to at least improve its symptoms. The ionizing radiation kills the cancer cells by damaging the DNA of the cancerous tissue. To avoid the radiation from killing healthy body cells, hospitals use specially shaped radiation beams aimed from many angles to directly intersect the tumour, so that most of the radiation only affects the tumour and not too much of the surrounding tissue. The primary method of treatment for most isolated solid cancers is surgery. In localized cancer, surgery is used to remove the entire cancerous mass, and in certain cases the lymph nodes from the area as well. Palliative care is a treatment that focuses on making the patient feel better by minimizing physical, emotional, spiritual, and psychosocial distress. This treatment is different compared to the rest, as its primary focus is to improve the patient's quality of life rather than to cure the cancer. However, despite all these various methods for curing cancer, many people still die due to other factors like age affecting the likelihood of success. Hopefully in the future we can get a much more efficient cure for cancer.
Now, it is time for a debate on the topic of cancer. Currently, clinical trials for treatments of cancer are mostly conducted on younger patients, and so most of the treatment being researched is more compatible for them. However, it is statistically proven that the likelihood for many cancers increase with age, so that the majority of cancer sufferers are much older than the clinical trial subjects. So the question is it right for cancer treatment research to focus on younger age groups when older age groups are the ones that are more likely to suffer from these cancer types?
Well, Rohan, I'm going to look at this from a statistical approach. After all, it is better for the researchers and scientists if the sample size of the patients is larger. And with a younger batch, you have access to a much larger sample, meaning that more results can be collected, and therefore the validity of the results is likely to be larger. With this as well, you can find out how cancer varies among different ages, even if it may be that older people are more susceptible to cancer.
That's a good point, Aaron. But cancer can start at any age. Furthermore, as you get older, the higher the chance of you getting cancer. This is because age is the biggest risk factor for cancer. Therefore, it wouldn't make sense to focus most cancer treatment research on younger groups, as then the treatments may not be compatible with older groups who are more likely to get cancer anyway. In my opinion, the research should be done on all groups, if not older groups more.
Well, I see where you're coming from, Rohan, but we first need to consider whether these trials are actually effective. It is known that in older patients, there are generally more complications which can influence the effectiveness of a drug or a treatment, meaning that it may not be the best to try on them. However, in younger patients, where typically the immune system is much stronger and more able to deal with new treatments, it is more likely that the effectiveness of the drug can be visualized, and therefore researchers and scientists will be able to obtain more results that actually mean something. In this way, I feel that if we shift our focus towards younger people, we can find out sooner if the drugs are effective. And in this way, we can then proceed to testing on other age groups, such as the older age groups.
Well, that's a great point, Aaron. And with that, let's wrap up this debate. If you guys have any opinions on this that you want to share, please do comment it down below.
Cancer is a vicious disease that attacks and kills many each year. However, patients should never stop struggling to survive and to beat cancer, as you are only guaranteed to lose if you give up yourself. Even as you watch this video, researchers are working diligently to further treatment and discover an effective cure. With this in mind, we would like to leave you with the quote from Thomas Edison. When you have exhausted all possibilities, remember this: you haven't.
Thank you for watching. Make sure to like, comment, and subscribe, as we will be posting more videos in the future. We also have an Instagram and Twitter page, so make sure to follow them as well, as we will be posting content on there in the future as well. Thank you.